现场的长官、与会贵宾。
Ladies and gentlemen, good afternoon. Thank you and welcome to join us in the International Business Matchmaking event of Digital Healthcare 2021 organized by IDB. We hope that through the event today, we will be able to facilitate partnership between Taiwanese vendors and international vendors. We're having an international business matchmaking event today, so we have an interpretation service provided today. Feel free to use the language service if you need to. And today we have a Spirit House, Mira Rehab, Tetsuyu Healthcare, Zenkokai, as well as Japan QLC to present to us their business approaches. We hope that through this matchmaking event, we will be able to facilitate strategic partnership between Taiwan and the international society. It is our greatest pleasure to have Mr. Zhong of ISTI ICHI to say a few words to us. Good afternoon. Senior Commercial Officer Huang in Healthcare and Life Science and British Office Taipei. Distinguished representatives from the UK and Japan, as well as ladies and gentlemen, good afternoon. On behalf of IDB, I would like to extend my warmest welcome to all of you to join us in the International Business Matchmaking event of Digital Healthcare 2021. Our organization basically organized a lot of visit tours to bring local vendors abroad to visit various sectors. And due to COVID-19, we can only organize an online event like today's. With the challenge of aging, long-term care presents a very large business opportunity. In 2020, the industry of smart healthcare represents $140 billion US dollars, and the CAGR will be 17%. In Taiwan, the market of smart healthcare is about 200 billion NT dollars, with a CAGR of 6%. So the business opportunity is great. As you may already know, the advantage of Taiwan is our development in ICT. Taiwan also has a very good health insurance system, which is why Taiwan is very strong in system integration. We have presenters today from the UK, Singapore, and Japan who have innovative business approaches. They also have a lot of geographical advantages. Combine that with Taiwan's advantage, I believe that we will be able to create a very good opportunity together. I am very happy to be able to welcome all of you to join the event today. We look forward to the collaboration and partnership between Taiwan, the UK, Singapore, and Japan. I'd like to wish a great success to the business matchmaking event today. Thank you very much. Thank you, Mr. Chong. If I may ask you to remain on the stage. We'd also like to invite Mr. Huang from British office to take a picture together. And I'd also like to ask our presenters on the remote platform to say hi to the audience. The first presenter from the UK is from Spring Health. It is a very good opportunity for us to organize such an event so that we can communicate with each other in the one-on-one matchmaking session after the presentations. We would also like to welcome Mr. Yoshinaga from Japan QLC. We have speakers from various parts of the world in different time zones. We have 5 presenters, and we will be able to hear from them directly about their organizations and companies so that we will be able to understand their offerings in long-term care and identify partnership and collaboration areas. Let's first have a photo call for our guests in the event. Mr. Chong and Mr. Huang, please look at the camera. If I may, could you please stand closer to each other? And please have our thumbs up. Please look at the camera. Now we have our international speakers on the conference platform. So let's have a picture together. Please look at the camera. If I may, please have your thumbs up, please. Thumb up, please. One more, please. And also, I'd like to ask Mr. Chong and Mr. Huang to remove your facial masks so that we can have a picture together. Thumbs up again. So a big thumb up to the future development of digital healthcare. Thank you very much. Let's once again put our hands together for our distinguished guests, Mr. Chong and Mr. Huang. With the leadership of IDB, we're able to work with the international community to create more business opportunities for digital healthcare. It's our privilege and honor to have speakers from the UK, Singapore, and Japan to join us in the International Business Matchmaking event of Digital Healthcare 2021. We're going to proceed to the presentation sessions, and we believe that through these presentations, we will be able to better understand each other and create business opportunities in digital healthcare. So without further ado, I would like to introduce to you our first speaker. The representative is from Spirit Health, which was established in 2007, which is a very important partner. It is a system integrator and a healthcare provider. At the Clini-Touch V, they provide monitoring and remote communication services. They also provide therapeutic approach for long-term care and acute care.
Hopefully I'm online now. I just want to say hello to everybody here. Thank you very much for inviting me to this International Business Matchmaking event. My name is Dr. Noel O'Kelly. I am Clinical Director of the Spirit family of companies based in the UK. I'm actually in Spain at the moment, so it's the morning here, so good afternoon. Just, oops. Seems to be on. Let's try again. Can I go back to my slide, please? Okay, so today I'm going to talk to you about our digital health platform, which is provided by Spirit Health called Clini-Touch V. A little bit about Spirit Health Group. We are one of the fastest growing companies in the UK. We are not just a digital health company. We also provide care to lots of patients within the NHS within England. We have over 50,000 patients that we manage within our primary care practices. We're the largest and fastest growing diabetes education program within the UK. So we bring a slight uniqueness to digital health in that we understand healthcare and clinical pathways, and indeed we pull on our resources across our healthcare group with many of our employees and our staff who've got over 150 years of collective NHS and healthcare experience. Previously, before I was in Spirit Health Group, I was a primary care physician and a medical director of a large community trust in the UK for over 30 years. So what is CliniTouch V? So CliniTouch V is a software platform that enables digitalization of clinical pathways. It does this by providing effective remote patient monitoring. It's fully configurable to multiple pathways and conditions. And indeed, we deal with diseases as widespread as COPD, heart failure, frailty in care homes, frailty in people within their own homes, Parkinson's disease, pulmonary rehabilitation, etc. So it's fully configurable to whatever clinical pathway you could think there exists. It also supports patient empowerment with education, self-management in the platform. It's a registered medical device. One of the things I think also in our favor is we have a number of published proven evidence demonstrating both improved care, health economic benefits, and also system outcomes within the NHS and other healthcare areas. Oh, there we go. Why should you choose CliniTouch V? I think there's three real reasons. It saves time for clinicians and for patients. It's been proven to be very health economically benefits, and it also improve outcomes for services and also, most importantly, for patients. Does this because we can give cost-effective consultations, so reducing the need for face-to-face appointments, so patients can be consulted remotely. We have very good feedback from both patients and clinicians using our remote patient monitoring. We help with patient empowerment with our education and information platform, and also we help for clinicians to try and get a bit of feedback. We also help clinicians to prioritize what patients they need to see. How it works is we connect patients to clinicians through the CliniTouch platform. So patients fill out a number of intelligent health questionnaires specific to their conditions and also record biometric data through wearable devices. The system then prioritizes those patients, the red, amber, green, and this is then available to the clinician. So the clinician can then look at a prioritized dashboard and then can connect to the patient either through video calls or messaging. Really, it's configurable to any pathway. I did talk about some of the diverse pathways that we're presently using CliniTouch V within clinical services. We have shown the ability to discharge patients from hospital earlier, supporting the community, which creates flow through a system with reduced length of stay. We know the importance of prehabilitation. We know that there's good clinical evidence that reduces inappropriate admissions, but also reduces length of stay. We get better patient outcomes from prehabilitation. We've lots of evidence around detecting early signs of exacerbation of deterioration, resulting in reducing avoidable admissions. Obviously, as it's a remote-based platform, it reduces travel costs and travel time for clinicians, but also increases accessibility for patients within their own home. It also avoids the need for outpatient visits because obviously you can provide virtual outpatient visits through the platform. Just to go through some of the platform features, I'll start at 12 o'clock and work clockwise. It's fully configurable. We are I suppose, content agnostic. So a lot of my role is to work with clinicians and look at what content they want that will give them the best opportunities and the best information to make quality clinical decisions on their patients. It's accessible on any wearable Bluetooth-enabled device, and thus it captures vital signs and health trends data. Patients and clinicians can communicate either through messaging through the platform or through high-quality, high-def video calls. The system RAG rates patients into red, amber, green. So on the dashboard, patients can then look at their caseload of patients and identify those who are most in need. It also gives real-time analysis of patient data, but also gives data for services and cohorts of patients as well. I think one of the benefits for me as a clinician in using remote patient monitoring is that I'm not just seeing a patient at a point of care for 10, 20, or 30 minutes in a clinic environment. I'm able to look at longitudinal care and see how the patient has been over days, weeks, or months as required. We have educational content within the platform, which is multifunction. So we can have written material, webinars, exercise videos, really what is most appropriate for the needs of that patient. We're fully interoperable with other systems using the FHIR system, HLA7 compliant. One of the things I'm really interested in as a clinician is that we show that health technology works, and we're one of the few health tech companies that have a number of peer-reviewed published research. Some of those research that we've done has showed a 2/3 reduction in unscheduled COPD admissions, both in an urban and a rural area. We looked at return of investment of 484%, which equated to reduction in admissions, but also more economic and productivity within clinicians as well. We have a 90% plus high levels of both patient and clinical satisfaction. We recently, during the COVID-19, set up a digital COVID-19 virtual ward, and that's just about to be published in December in the British Journal of Healthcare Management. That showed within that cohort of patients a reduction of 2.2 days in length of stay within hospital, which equated to about £1,000 or 1,000 English pounds, or about $1,400 saving per patient who went through the system. Alex Woodward was one of the senior clinical leads we worked with, and we've worked with him probably over the last 6 years, both in his respiratory and cardiac services which they have in the community. At the time COVID-19 hit, they asked us to extend into a COVID-19 virtual ward, and we also helped them to reset on their pulmonary rehabilitation service as well. So what are we looking for and why are we here today? Well, we want to connect with people who feel the same way about health technology and how we can use it within clinical pathways. I think if anything, COVID-19 pandemic has shown that we need to find new ways that we can connect to patients in a safe and easy way. We're very keen to collaborate. We collaborate with a number of other organizations and firms. Sometimes other firms do things better than we do, so we work together with them. We're looking for local partners with an interest in digital health, or health organizations who want to look at how they scale up the remote patient monitoring capabilities, and also potential resellers of the CleanTouch platform within Taiwan and internationally. Personally, I'm really interested in trying to develop a global network of key opinion leaders. We have, I think, health technology is becoming almost a specialism in its own right. It's still kind of in its infancy. I think we need to help our clinicians to be able to see the benefits that we can use these tools, and also the evidence that we can build moving forward. So thank you for listening to me today. On the left side of the screen, you'll see our website. There's a wealth of information of what we do on that. And on the bottom right side, you have my email address and also my personal mobile number. I look forward to hearing from any of you. Thank you very much.
Thank you very much for your presentation. And we are going to have a representative from Mira Rehab. Mira Rehab was established in 2012. The offering is about the combination of physiotherapy and cognition. As mentioned earlier, Mira Rehab was established in 2012, which is focusing on imaging to monitor mobility as well as the movement of the patient, along with the gamification to provide remote rehab as well as cognition training. The area of application includes neurological rehabilitation, physiotherapy in the bone department, peds, as well as fall prevention. And the target population also includes the aging population. Our presenters from the 5 companies will talk to us about their company, their organizations, as well as offerings.
Hello, everyone. My name is Matthew Papagno. I'm the Chief Executive Officer at Myra. Thank you for having us here today. I hope you can hear me okay. I know my camera's off when I share my screen, but I am here. I'll share my camera again. Can someone just confirm maybe a thumbs up if you can hear me now? Okay, wonderful. Thank you so much. So I am, like I mentioned, the CEO of Myra Rehab. I'm coming to you live from Boston, Massachusetts at 2:25 here in the morning. So good afternoon to you, and thank you very much for having us. It's an honor to be participants here today. Myra is a digital health company, and as mentioned in the introduction, we are very much focused on improving physical therapy outcomes and as well as prevention and cognitive health. We'll get into a bit about what we do here and the markets that we currently address. As mentioned, we were founded in 2012. Our global headquarters is in London. We do have tech offices in Romania, and we're active now in 14 different countries with customers, in 17 countries now with distribution partners, and we're always looking to expand. Myra comes about based on the need for cognitive and physical therapy improvements. What we see is that these markets suffer from a major lack of motivation and patient retention. I can speak to this personally, not as a clinician, but as the husband of a clinician. My wife is a physiotherapist herself. What we've studied shows that 14% of patients will not return after their first physical therapy visit. 70% will not comply with physical therapy exercises in their full. And we've done a lot of research into why is that happening. Well, it's highly repetitive. Sometimes it's painful. And the long-term impacts is that because it's such a long commitment, there's little accountability between the patient and the clinician. The lack of compliance can really lead to frustrations, including poor outcomes. Poor outcomes create additional costs, not only in the patient's well-being, but in insurance claims and additional impacts, such as payers having to pay for additional procedures, individuals suffering from low healthcare outcomes, employers from losing working hours, and providers from the frustration of not experiencing a good relationship with their patient, all because of this lack of motivation. So Myra is a solution that's geared directly to address that. And there's a lot here on the screen. So I will, I'm being told I can't see my camera. We're having a glitch on my side where if I'm sharing my screen, I'm not able to share my camera at the same time. I apologize for that. So I will share my camera when I stop the slides here at the end. So apologies for the interruption. So back to what Myra is. Myra is, what we take is, you can see on the left here is Myra Clinic. This is our first product launched in 2012. We use camera tracking to track a patient's motions, and we take physical therapy motions, which are prescribed by the provider, and incorporate them into video games. We now have over 450 different combinations of video games that a patient can play by using their motions to control their interactions. This was launched as a clinic-based product with 3D motion tracking in 2012, particularly in the UK, where we're active in 14 NHS trusts. And now, given the COVID-19 pandemic, we've pivoted more toward home care with the launch of Myra Home, so that a patient can play from their own laptop. And in the future, we're moving toward the mobile device applications of 2022 and beyond. Ultimately, Myra's major focus is not only on motivation, but on the full continuum of care. With these product suite, a patient can join Myra from the acute setting and immediately post-injury all the way through to prevention in the future. And the results speak for themselves. So as I mentioned, 70% of patients do not comply with physical therapy exercises. Here at Myra, we see 70% patient retention. This is not just on a small basis. We've seen this through over 5,000 patients, over 70,000 exercises, 70,000 exercise sessions, and now active in 17 different countries. A major focus of what we do is clinical based. Everything that we've created here at Myra is with a key opinion leader, with research partners, and through grants and studies. And here's a look at some of the evidence which we have published that shows Myra's clinical benefits. In 2019, with the University of Manchester, we looked at the instances of patient falls and how we can prevent them by incorporating balance exercises into Myra. We used the standard Otago therapeutics for falls prevention and did two different patient groups. One received standard therapy, one with Myra. With Myra, we reduced patient falls by 64%. At the conclusion of that 12 weeks, we had 86% patient compliance, and over 90% of the patients would recommend Myra to their peers. This is just one example of many studies. Myra has been used for patients ages 3 to 102, and for everything from pediatric neuro conditions, sports medicine, MSK, to falls prevention, and everything in between. The market is huge. I heard it referenced early in the open. This is just a small vision of a near-term market if we looked at the US population over the next 6 months, with a 19 billion total addressable market with a massive CAGR. And we see the evolution of telehealth and digital therapeutics becoming the primary focus of the market. Myra is poised for this space. Our current approach is to work with providers in a B2B opportunity in the UK, EU, and Southeast Asia. We work directly through suppliers. We sell direct to clinicians. We are expanding to work with private payers, national health insurers. We can also work with employers. And when we launch the app, we'll go directly to individuals as well. Our current focus is on Myra Clinic and Myra Home, evolving to Myra App. And ultimately, we want to expand our geographical reach. Myra Clinic, the original product I showed, was a direct sales traditional model, typically based on US prices around $2,500 per year, where we're moving now toward a service as a software, starting at an individual patient price of about $35 per month. If you look at the competitive landscape, we look at all the digital therapeutics and physical therapy. What's accessible and what's motivating, what's making patients actually get better. So we take our motivation and our accessibility and believe that we have key differentiating factors, the clinically proven results, the progress and motion tracking, and our educational content. It's also very easy to use and software agnostic. So again, in short, it's engaging and motivating, easy, clinically proven. And by sensor agnostic, we mean that you no longer need three-dimensional cameras or body sensors to use Myra. Any patient with a laptop can play Myra. It's fit for the continuum of care, and it's totally customizable. Myra also works a lot with industry in supporting other solutions for other companies to expand as co-development projects. Our team has primarily been together since 2012, although I joined in 2019. Our software developers have been with the team since 2015, and it's really a team that's put a lot of research in, and the results speak to themselves. Our 10-year vision is to become the global leader in digital physical therapy health, and the big reason for accepting the invitation here today is that we are looking to move faster in our expansion process. We would love to talk with partners and collaborators across the space. I'll stop sharing so that you can see my face for the last few minutes here. So we are looking to expand our reach with either resellers or businesses with like-minded orientation where we can work together to collaborate on solutions. I hope the presentation has been informative, and I look forward to continuing into the marketing, the sessions here later today. Thank you so much for inviting us.
Thank you very much, Matthew, for your presentation. Our next presenter is from Singapore, Tetsuyu Healthcare Holdings, which provides ICT, AI, imaging, diagnostic technologies for community and home care. Tetsuyu also provides online diagnostic services, wound imaging AI analysis, as well as daily journal recording. Their system is now being utilized in Singapore and Hong Kong. Tetsuyu is now working with Tokyo University to conduct remote healthcare for wound care of diabetic patients, as well as bed sore care.
好，我会 share screen.
I will share screen. Will that be okay? Hi, everyone.
From Tetsuyu Healthcare Holdings. So I'm the business manager over at Tetsuyu. So today I'll be presenting to you Cares for Wounds, one of our products. Next slide, please. Yep. So who are we? We're basically a Singapore-based health tech startup specializing in innovative and affordable applications. So we gained a number of awards across the years, including the Asia Pac 2017 Elder Care Innovation Awards of 2020, as well as we are certified with the ISO 13485 as well. So we are co-founded by Dr. Shinsuke Muto, a Japanese cardiologist and home care specialist, as well as Ms. Ng Lian, who's a former senior banker. So basically what we aim to do at Tetsuyu is that we want to provide insights for quality care, help to deliver healthcare value, providing affordable innovation through our ecosystem of innovation. Next slide, please. Yeah. So what do we mean by an ecosystem? Is that these are the products that we have in Tetsuyu. So on the back end, we actually have CARES, which is a care management and remote monitoring platform. So that actually forms the web-based platform of our system. And together it has two complementary apps. One is the Cares for Caregiver and the Cares for Wounds. So today I'll focus on the Cares for Wounds, where we actually use AI to enable better wound care management, because it actually allows for auto measurement of the wound, tissue classification, and it also provides certain treatment guidance to the clinicians as well. Next slide, please. Okay, so what is Cares for Wounds? Basically, we use AI to enable wound imaging, measurement, provide assessment, as well as monitoring. So the aim of it is to really increase the productivity and quality through an evidence-based approach. So it consists of two platforms. One is the mobile app, where the AI is embedded in. Second is the website, where we actually use it for remote monitoring and teleconsultation purposes. At the same time, our app currently is CE Mark certified, and we also most recently got the HSA Class B approval as well.
A rapid rise in aging population and prevalence of diabetes has accentuated the need for good wound care. Despite our excellent healthcare system, Singapore has among the world's highest rate of lower extremity amputations. To avoid this, it is crucial to detect wound deterioration early for timely and effective interventions. However, current methods of manual assessments can be painful, time-consuming, and inconsistent in the standard of care. Cares for Wounds is an AI-enabled wound assessment and monitoring system that makes the wound management journey safer and a little more comfortable. With traditional methods of measuring wounds using rulers and probes, patients have to bear with repeated pain and infection risks. Powered by artificial intelligence, Cares for Wounds automatically measures the length, width, and depth of the wound as soon as clinicians take a wound image. Users can easily make adjustments if they're not satisfied with the AI-generated outcomes. There's no need for wound contact during measurement, reducing risk of infection. The rule engine also flags suspected infection, enabling early intervention. A typical wound management session, from imaging to treatment plans, is completed within 1 minute using Cares for Wounds. This is 10 times faster than the manual process. The wound healing progress is visualized with charts and trend lines, allowing clinicians to remotely monitor wound management effectiveness in real time. Clinicians can also keep track of other important parameters such as blood glucose, hemoglobin levels, and nutrition with the system. Workflows in Cares for Wounds are designed referencing wound management concepts such as the triangle of wounds, time assessment model, and moist method for treatment planning. Scores such as push or wound bed scores are automatically calculated and charted to help clinicians monitor and objectively determine next course of action. This allows less experienced clinicians to overcome skills gaps and conduct good assessments. Cares for Wounds is portable and easy to adopt. It can be installed into any iPhone or iPad without the need for any additional device or measurement tool. Patients' assessments are automatically uploaded onto a cloud platform, where all members of the care team can be equally informed and engaged in this process. Cares for Wounds is a powerful tool for standardized and effective wound management to achieve good healing outcomes. It augments clinical training to reduce the knowledge gap and solve pain points in wound care.
Thank you. So that's a quick introduction of what Cares for Wounds does and what it aims to do. So these are the key goals for our product. Firstly is to really assist with the people in terms of, because inside our system, we actually have clinical guidance. So it really helps in terms of skills training. Also roles redesign. Instead of having to have a wound specialist to do the wound assessment each time, they're able to actually take a step back, actually have the junior clinicians do the wound assessments through a guided approach, and for the wound specialist to actually do remote monitoring, review these assessments, review the results on the web system, so that if needed, they can actually then plan for early interventions. So this really saves their time, because instead of having to spend 1 hour to only visit one patient, they can spend 1 hour actually reviewing 5 or even 10 assessments at one go. So there's also escalation protocol, because our system is able to flag out potential infection for the wound. So junior clinician will then need to escalate it and to inform the more senior clinicians that this wound is likely to be infected. So at the same time, the tools are portable. It can be downloaded in iPhone and also as iPad. There's also provides standardized records to make sure that all your assessments are done properly. And of course, there's remote monitoring. So if needed, you can also get into a teleconsultation call with your clients, with the senior clinicians as well, to gain advice. So the data is also, there's automated data capture. Just take a photo and the measurements, the tissue classification results will be there, and all the information that's captured in the mobile app will be synced into the web system. We of course follow a clinical workflow using the time dime. We're also referencing various wound concepts like the time dime model, the moist concept, etc. And of course, using AI and big data to actually get advice in terms of what are the treatment guidelines that the clinician should follow. So what we aim to do is basically having a less painful or rather pain-free method of actually doing the wound assessments, and henceforth leading to happier patients, and of course reducing the cost required for wound assessment and management. Next slide, please. Thank you. So this system is actually created with many people. So first and foremost, we have our internal team that developed the mobile and web application for the auto measurement feature. We also collaborated with A-Star to actually develop the AI technology in order to allow us for wound-based segmentation and auto tissue classification. At the same time, a lot of our workflows, treatment guidelines, treatment plans that we have in our system was actually developed through a lot of key opinion leaders. For example, in Japan, Professor Hiromi Sanada. In Singapore, we have from Tan Tock Seng Hospital, Dr. Joseph Loh, St. Luke Hospital, Sister Susie Goh, and Rensselaer Hospital, Sister Jenny Sim, as well as Dr. Divya Panikar, a clinician and wound trainer from Malaysia. So we work with all of them to actually do co-development of the product, do prototyping, do trials and validation, also for research collaboration, and of course, market development. Next, please. So in a nutshell, basically using our system, first and foremost, what we want to do is do the assessment. So we actually provide a holistic approach because in our system, you are also able to keep track of the patient condition. For example, what are the medical history that he or she may have, what are the vital signs that he or she has as well. So this is important because, for example, if the patient is running a fever, it could be an indication of an infection. If the person actually has high glucose level and has a history of diabetes, these are actually some underlying conditions that may actually need to be treated first before the wound can heal well. So it's actually a very holistic assessment. Also, we use the triangle of wounds to do the wound assessment and of course to assess the wound size, etc. So through the assessment, the system will actually recommend a set of treatment objectives for a clinician to choose from. It will also recommend to them what are the treatment plans, what treatment products they should use. So from there, once this assessment is done, there's a progress monitoring, as well as the clinicians can come in to do the review and of course plan for interventions, and the cycle will continue. Next, please. So what we want to enable to actually provide on how we want to actually enable good wound management is to be first and foremost more effective. What we discovered is that using our system, it actually is 11 times faster than the manual assessment. So it actually has the productivity savings. It's repeatable because automation provides less errors and higher accuracy, and it's transferable because there are clinical reference guides to basically help guide junior nurses in not just wound treatment, but also wound assessment. Next. So for our system, we actually have piloted it across many different countries. So in Japan, it was piloted in 12 different sites to actually, for the tele-wounds function. It actually has been applied in Singapore as well. So in midst of adoption, we have things like, we have organizations such as Rensselaer Hospital and Yok Eun Care Center, etc. We are also working with some companies to actually pilot this over in China, Australia, New Zealand, and many other countries as well. In Hong Kong, it's actually been adopted also by Shen Feng Hui Nursing Home, as well as the Prince of Wales Hospital. Next, please. So this is actually a measurement validation study that we have conducted together with Tan Tock Seng Hospital. It was also published on the International Wound Journal. So what it aims to do is to test our system for the intra-rater reliability as well as inter-rater reliability, and all the ICC ratings are actually more than 90% or more than 0.9, which if you see in the table below, it is of excellent results. So in conclusion, CAS for wounds is actually a very useful adjunct in monitoring diabetic foot ulcer wound progress, and is non-inferior to its international counterparts as well in terms of its reliability. Next, please. So, of course, being ISO 13485 certified, we also have done our internal design validation for length, width, and depth. So for this ICC rating, in comparison for manual iPhone and iPad, what we discovered for length and width, we've all received excellent results, which is same as the Tan Tock Seng Hospital study. For depth, we've actually achieved good results, which is good because this actually in comparison to traditional methods of actually wound measurements where you actually need to prop a wound, taking a cotton bud and then probing the open wound, which can be very, very painful, and also there's a risk of infection. Having a good, or for some clinicians, in order to reduce the pain, they may actually just visually estimate what is the depth of the wound. So hence having a system as ours that is very consistent is actually a very good method of actually assessing the wound measurements. Next, please. So we've also done a health economic study, so conducted over 2 months at the nursing home settings. And what we realized is that the rate of Falanga score improvement, which is the condition of the wound, actually improved by 2 times, as well as the average time for each review actually reduced by more than half. Next. So these are the benefits that you gain using Cares for Wounds. So first and foremost, portable, easy to use. If you download into any iPhone, like the iPhone 11 Pro or iPhone 12 Pro, it means that it's actually one-handed operations. You can use it using one hand. So it's very portable and easy. Then you can also access the system remotely through Google Chrome or Safari web browser. So of course, it's to actually improve and increase productivity, because from imaging to treatment plans, all can be done within 1 minute using Cares for Wounds. Also reduce risk because of the non-contact process, so it's painless and infection risk-free. It also provides early interventions because it saves the wound specialist time. They can actually remotely monitor and henceforth advise if any intervention is required. And in our system, it also helps to detect possible wound infections as well through algorithms. It also helps improve quality of care through the remote monitoring and standardized workflow assessments and documentations, and clinical reference guides for junior clinicians. So all in all, is to actually provide better healing outcomes, as it can be shown in the health economic study that we've actually conducted. Yep. Next, please. Next slide. Yep. So if you're interested, we can, next slide as well. Thank you. So if you're interested, you can of course reach out to us. You can reach us at tetsuyuhealthcare.com to actually arrange a demo or to find out more about our system. What we hope to achieve through this session is actually to get to know more collaborators that we can work with to either distribute the product in Taiwan in this industry. And the distributors that we're looking for would be people who have good network across the key opinion leaders or the wound clinicians in this industry as well. Thank you very much for your time.
Okay, thank you very much from Tetsuyu Healthcare, the presentation from Tetsuyu Healthcare. Next, our speaker is Denkukai Social Welfare Corporation. The company holds numerous elderly care institutions, including long-term care, short-term accommodation, daycare, and the care for the dementia patients. They also established Santa Fe General Institute to research and produce relevant equipments. We would like to welcome Mr. Miyamoto to deliver the presentation for us. Hello, everyone. My name is Miyamoto, representative of the Social Welfare Corporation Zenkokai. The topic I want to explain to you today is the long-term care business and technology and how to provide corresponding support for Taiwanese companies. First of all, I want to introduce the overview of our company. Zenkokai is a social welfare corporation. It's mainly engaged in long-term care and businesses. Our headquarters is located in Ottawa, Ward of Japan, based on various compounding long-term care facilities and nursing centers. There are also special care centers, nursing homes, and special care centers for the demented. On the right-hand side, you can see the company's business philosophy, that is to become the model of the business and a pioneer in the future for the industry. We have a positive attitude and an open-minded mindset to accept new technologies, hoping to bring a new atmosphere to the long-term care business. Based on, in view of our historical evolution, we have always focused on the long-term care business. From the 25th year of Heisei, that is August 2013, we have engaged in we have started to establish the company, and in Heisei 29th, that is October 2017, we established the largest composite social welfare organization, Santa Fe Institute in Japan. The Santa Fe Institute in Japan is the first social welfare legal person in Japan, and there are two directions for development. On the left-hand side, that is to develop talents, and on the right-hand side, the scope is a smart care operating platform that is to solve the problems for long-term care institutions. For example, the supply of human resources in order to enhance the efficiency of long-term care business, as well as scientific long-term care methods to improve the quality of care. We also partner with the government's plan as the direction of our future development. Next is the long-term care mechanism developed by our company. The SMART model was developed by a variety of new technologies to create new nursing services. With the current nursing methods, it is necessary to promote new equipment and new technologies. With existing manpower or institution, it would be very difficult to accept or adopt these new models. So how to use new equipment and new ideas ingeniously, that requires the talent of the manpower. So our purpose is to cultivate human resources to develop smart and intelligent nursing staff and to learn new technology and equipment. We basically use ICT as the environment for development. SCOP is Smart Care Operating Platform. This is the long-term care smart platform that we develop. Using the system platform, we're able to systemize the data, standardize, and flexibly apply the technologies. The next step is to leverage technology in our business model. The characteristics of our company is the hybrid model, which combines people and equipment in the long-term care business. Our self-developed system platform is developed by engineers and nurses working on site, as well as the elderly who were taken care of. They go to the institutions of the nursing center to learn from each stakeholder to develop the system. All robots and equipment have been tested in our institutions. A detailed analysis is conducted to improve customer service and reduce the burden of our employees, then to expand the project to other institutions rather than adopting existing systems or products on the market. The next thing I want to explain is the plan to improve efficiency. Due to time constraints, I will not be able to introduce them in detail. In short, it is a time study to make a visualized picture. We measure and analyze the time required for each nursing work to emulate unreasonable time and create a work balance. We are introducing nursing robots and develop internal care record software to improve efficiency. The goal is to accomplish the largest amount of work with the least manpower. And in terms of the utilization of technological equipment, robots and monitoring devices, there are all kinds of auxiliary robots, sensing equipment, or technologies promoted by the vendors around the world in the market. After we have tested to see whether they can match with our platform, we will try to introduce them to our long-term care institution. We will not determine whether to introduce these equipment to our organization based on the quality of a single device, but based on the overall planning of the business, and also considering the quality of long-term care from all different aspects. This picture is on the nursing staff of our general nursing facility. Compare that with our own nursing facilities. The left is the general nursing staff. They usually will do the work while recording data on paper and then input this data to the computer in the office. They also involved in a lot of labor-intensive work. It is very energy consuming, and it also use PHS phones to communicate with each other within the facilities. But in our institutions, in terms of the data recording, we have integrated all the different platforms. We'll be able to record the data and provide feedbacks on site. Workers do not need to write everything down on paper and then input them into a computer when they go back to the office. And the supporting equipments will be able to combine with mobile phone or tablet. Any information needed in the process can be obtained from the platform. And the equipment or facility use will try to use wearable headphones or carrying aids, for example, mini scooters, Segway. This will be able to save us a lot of time and also the physical exhaustion of the staff, which can reduce the burden of these workers. In the past, we were focusing on the patient care, and now we'll be able to reduce the waste for the employees so that we can provide a better working environment for them. And this is considered a very important improvement for us. The last part is the support of the domestic market and the Taiwanese vendors. As we know, both domestic and the rest of the world are facing the same social problem or issue. The first is the estimation of care costs. In Japan, we've been facing the problem of declining birth rate and aging population for a long time. And long-term care costs will be further increased in the future. In Japan, there is long-term care insurance. Those who need the long-term care will be able to apply for the insurance policy. But the increase of the cost of long-term care will make these insurance coverage insufficient. In 2005, we're about to face a big gap, and the next gap will be in 2035. In 2025, the clump generation, which is what we call the baby boom generation born after the Second World War, these elderly people at the age of 75 years old, the shortfall, the gap in the nursing staff at the time will reach 310,000 or 320,000 by 2040. And in the future, the biggest shortfall in nursing care manpower will be as high as 750,000 people. So how are we able to sustain these capacity with a limited budget of the government? That is considered a very important issue in Japan. And what can we provide for Taiwanese companies? Zenkokai can provide Taiwanese industry operators the opportunity to visit various social welfare institutions in Japan. We have social welfare institutions and nursing homes in all over Japan, which can be used as a destination, can be appointed as a destination for on-site observations or inspections. And regarding the on-site visit of social welfare institutions, from the visit of domestic government officials to media and the industry, we have arranged dozens of visits per year. During the past 2 years, due to the pandemic, we can only do on-site online visits in the system. In addition to the long-term care business, our entire platform promotion will be also carried out horizontally. So this is the live-oriented and nursing robust experiment or tested carried out in the Japanese market. And this is a robot approved by the Ministry of Health and Welfare of Japan to conduct these test on the spot. And there are more than 80 experience centers across the country. In terms of the timing of promotion, these live-oriented care robots laboratory started in 2009, and currently we have been cooperating with more than 100 manufacturers. In 2020, there were a number of cooperating partners was 19, and this year it has increased to 29. And whether it's the product commissioned by private company or university or other products that we develop ourselves, we welcome all partners to provide us the services for our products. And the company's platform also allowed the on-site personnel to use various device interfaces or to record data, as well as the information related by physicians and families. Through these structured platforms, these big data can be converted into AI data and provided to operators, managers, or academia for effective use. Finally, in today's introduction, if there's anything you do not understand, please feel free to contact with Santa Fe Research Institute. I believe there are still many issues to be solved for long-term care in home and abroad. We also hope to have opportunity to provide communication and assistance. Thank you very much. With that, I'd like to conclude my presentation. Thank you very much.
Thank you very much, Mr. Miyamoto, for your presentation. And we're going to proceed to the next presentation, which will be presented by our representative from QLC. QLC runs a rehab center. There are 2 sessions every day, one in the morning, the other in the afternoon. QLC provides 3 hours of customized rehab services, including oral health rehab, prevention of dementia, training of personal functions, as well as Tai Chi in seating position to promote the health of the elderly. The presenter from QLC is Mr. Yoshinaga. Mr. Yoshinaga, please. Hi, everyone. I am Yoshinaga from QLC. I'm very happy to be able to share with you the ideas of QLC. I will present you on 3 aspects. The first is about the service offering of QLC. QLC is a facility for healthy aging. QLC has a lot of experience in this regard. QLC is also a system developer. The third area is collaboration with the healthcare facilities. Today, I looked at a lot of Taiwanese vendors, which are mostly in the area of nursing homes as well as ICTs. And I believe we will be able to work a lot in trial sites, so I will particularly focus on that part. Our brand is LEV, and we provide aging club or daycare centers. It's a Let's Club. We have more than 160 centers. We have 10 direct centers and 150 franchise sites. In Japan, we serve more than 20,000 people, providing services listed in the following PowerPoint slide. As mentioned earlier, it's a half-day service, which is 3 hours, which covers rehab trainings. If you ever been to Japan and visited one of the care facilities, you can see that a lot of elderly people who go to the facilities, or sometimes we send people to do home visits. What we do at QLC is to provide daycare. We have more than 50,000 daycare centers in Japan. So basically, the same number of convenience stores in Japan. And in recent years, daycare centers are transforming themselves in Japan. 80% to 90% of the daycare centers are small scale or less than 100 meter square to receive about 10 to 15 elderly people on a daily basis. However, in the future, we're going to see a change that is to develop into a larger scale facility, which is about between 150 and 200 square meters to have 30 to 40 elderly people on a daily basis. In the past, when it comes to the daily centers or daycare centers, they also provide meals as well as bathing services to provide care to those who have a higher demand of care. In other words, the clients that we care was people that are more advanced in aging. However, due to budget limit, the Japanese government is encouraging us to provide services to maintain the health of the elderly so as to minimize the expenditure in this regard. Which is why 10 years ago, we saw a new area in this discipline, which is rehab focused. So for the elderly who are good in health condition, we provide rehab services. So with our brand, which is a Let's Club, we're not focused on the highly dependent population. So if you look at the PowerPoint, you get to see that we have 7 levels of dependence from level 1 to level 5, and from independent to less independent. We serve about 15,000 people. So their functional level is between level 1 to level 3. For level 4 and level 5, we define them as those who need higher support. So what we do is very close to what is offered in the rehab centers in healthcare facilities, including oral rehab. So basically, in that 3-hour session, there is exercise. There is exercise with machines or without machines or Tai Chi. So lots of physical exercises to improve the physical condition of the elderly, to slow their aging process. So that's the overall description of the service. And what can be combined with our ICT is described in page 4 of my slide deck. Since there is exercise intervention, we would like to measure the before and after effect. So far, in our system, when it comes to the performance outcome, the assessment tools are actually quite limited. So we're looking from the Taiwanese vendors to provide us with simple assessment tools to evaluate the physical condition or physical improvement of the elderly. So for example, we have a class of 30 people. When we take the measurements of their blood pressure as well as the temperature, it would take us a very good half an hour. So if we could have a assessment tool that allows us to monitor the temperature or heart rate of the 30 participants real time, continuously, and simultaneously, then that would be able to greatly improve our work efficiency and save us a lot of time. And secondly, when we have a physical or exercise intervention, we would like to have a before and after assessment to evaluate the balance ability of the elderly or the muscle strength of the lower extremity. So for those assessments, we are also in need of this kind of ICT tools.
If we can have a blanket or a mattress or a mat, then when elderly step on it, they'll be able to know the situation of the muscle. I believe such technology will be really helpful for companies like us. So that is the service that we provided, daycare service for these recovery or rehabilitation training. We aim at providing the services to access or getting the data for these elderlies in an efficient manner. And secondly, for system development, many of these elderly care services are funded by the insurance. So there are a lot of logistic work, that is to apply for the insurance claims. So we provided services to more than 200 companies that are able to use our system. The system is currently used for insurance claims. However, as I've mentioned earlier, if we're able to collect the data from the elderly population, it will be very useful to the government agencies. Starting from this year, Japanese government has initiated a new requirement, that is all the companies, if you're able to provide the data of the elderly regarding their health and report to the government, then the government will provide a certain amount of subsidy on a monthly basis. So the government is actually trying to collect more data of elderly through these agencies. So if we can have these kind of system development companies in Taiwan to work with us, I believe we'll be able to come up with solutions that really meet the demand of the Japanese government. And among the services that we mentioned, there are data from various exercises. For example, there are a lot of ICT or IoT companies. If they're able to measure the times of exercise, the results, and all these kind of systems will be welcomed by us. And the third thing that's related to ICT and IoT company is that for the elderly care services is actually separated from medical care services because they are covered by different insurance policies. And the gap between the two is that all the data are located in the healthcare institutions, which will not be shared with elderly care institutions. So we are trying to approach these challenges from a bottom-up approach. That is, we cannot access the data from large medical institutions. However, we're able to collect some data of the elderly and provide it to local clinics so that they can support the health of these elderlies together with us. This is the structure that we adopt. For example, for food disease, the care for food disease. In Japan, it is more of a less popular area, but what we are doing right now is that we can work with the related association in Japan. We'll be able to measure the food of the elderly patients and to provide these data through ICT technology. For example, if you need to measure their food, you probably need a sensor, and we are working with some IoT or ICT companies in developing these tools.
We also thought about maybe designing some shoes. However, when it comes to the elderly care, the population is not specific. So if we could have a mat, which is a digital mat, without having to remove your shoes, you can just step on the mat. And then very quickly, we can collect the data of the elderly, for example, the shape of their feet or their balance ability. And then with 3 or 4 months of follow-up, and then we can share the data with the community hospital, maybe through a online platform, so that data can be shared with the care providers and healthcare providers. So that's one of the things that we're working on. And right now, the focus is on foot. In the future, we can have something even more diversified to include diabetes or eye-related disease. So for this area, for us, this is not our advantage because we do not have sufficient ICT know-hows. So if we could, we would like to work with know-how developers. We can provide the venue and data and facilitate the collaboration between different care facilities. So today I talked to you about the 3 areas of the organizational focus. One is daycare center. The second one is system development for reimbursement mostly. Since we are trying to connect with the national system, we're also trying to see if there are also other system developers that we can integrate health data and then push the data to the government. And the third area is our practice in the community. So through the prevention of diseases and our involvement of ICT to collect data, and then further mobilize our partnership with the local community hospitals. So these are the 3 areas that we are working on. With that, I conclude my presentation. Thank you for your attention. Thank you very much, Mr. Yoshinaga, for your presentation. I'd also like to thank the 5 representatives from the 5 vendors for your sharing. We have about 15 minutes of coffee break, after which we're going to proceed to the one-on-one matchmaking sessions, which will start at 3:30. So please come back on time. And we are going to set up the venue. I'd like to kindly ask our participants in the conference room to bring your personal belongings with you and then leave the room so that we can set up the room. We are preparing some snacks and meal boxes available outside. Please use the coffee break to know each other, exchange business cards, and we look forward to the matchmaking sessions afterwards. Thank you very much.